Do you have knee problems? My name is Dr. Augustine. Today we're going to discuss how do we solve knee problems. We're going to be using an instrument called an integrator. We're going to actually have Nathan lay down and we're going to be doing some adjusting on his knees to help solve these problems. When we adjust his knee with it, it's low force, but it also delivers a vibrational frequency that will alert his proprioceptive nerves on how to keep his knee in balance. We'll be talking about nutrition, we'll be talking about other things that he can do, and just about anybody can do to prevent and solve those problems. So Nathan, you want to lay down on your back? Cool. So first we look at Nathan's leg lengths, and we're going to, he's been having some medial knee pain, the inside of his knee, right at the joint line. That typically implies meniscus injury. If we know you have a meniscus injury from an MRI, that's also helpful. So the first adjustment, this is an adjustment that I think I'm the only one that does this, for making his meniscus lay down nice and flat. This was me 25 years ago, training for a marathon. Tore my meniscus in my right knee. Had 4 opinions, didn't like it because I don't want them to take out 3/4 of my meniscus and therefore I'm going to have a knee replacement surgery in 20 years. Didn't want to do that. This adjustment makes it lay down flat. It'll heal up nicely with scar tissue. So we've prevented a lot of people from having knee surgery. That's a good thing. So with this, we're going to bring Nathan's knee up, out to the side, and pull as we straighten it out. Bring it back to the center, just like that. This makes that meniscus lay down nice and flat. We're going to do his right knee as well, just so you can see it in better frame. There. Out to the side, straight. There, out to the side. Feel that little shift in your knee? Mm-hmm. Good. So now the meniscus is laying down nice and flat. Now we're going to do the adjustment with the integrator. So we look at his leg lengths. We're going to push it anterior to posterior. That tremendously shifts his legs out of balance. We're going to push from back to front. Balance his knees, so that's what we're going to do. We'll bring his knee up here. Adjustment's going to be back to front. Perfectly in balance. Lateral side this way, testing his proprioceptive nerves this way. That's not good. So we're going to bring it downward here. And also get his ankle or mortise joint as well balanced. Medial side of his knee, that was fine. Pushing it up that way, that balance, throw him out of balance. Perfectly balanced. Now we're going to check torque. Inward torque, way out of balance. Outward torque, perfectly balanced. So then we're going to adjust his knee to rotate out that way. Lastly, his fibula, that was bad. Pushing it posterior or anterior to posterior was good. So we're going to adjust this fibula right there. Balanced. Lastly, we like to adjust the foot because many times the foot position, and as you know, many people have foot problems, can create problems in the knee. So pronation, it directly moves and affects his knee. Too much supination will also affect his knee, so we want to balance out the mortise joint too. So how we would do that was we would check, push it from lateral to medial. That wasn't good. Pushing it medial lateral was good. And we're going to adjust it that way. Awesome. From an adjustive standpoint, that's perfect. He's in great shape now. Next, we want to talk about nutrition because the knee can be influenced by his adrenal glands, his stress glands. His adrenal gland up here on the left side shares the same nerve supply as a muscle called sartorius that goes from his hip, rotates down into the inside of his knee. So when the adrenals are blown, people have too much stress, the adrenal is fatigued, that neurologic side is imbalanced, this muscle gets fatigued and it causes torque on his knee. He needs adrenal support. So to keep that knee stable and in balance, to keep his leg lengths perfect, adrenal desiccated, he's going to take 6 a day of that. Come on up, sir. So the plan going forward for Nathan is going to be taking some adrenal desiccated. Of course, I'm going to recommend that he gets better sleep, tries to reduce his stress, get a little bit of sunshine. 15 minutes a day would be really great. Certainly taking adrenal desiccated 6 a day, 3 in the morning and 3 at lunch. You take it too late on in the day, it's going to keep you up at night, which is not good for you. We're going to also give him LIGAPLEX 1, which is whole food nutrients to repair knee tissue, specifically cartilage. And also turmeric forte, a special type of turmeric that's not bound to pepper, but it's bound to fenugreek. It's been so amazing, it takes it even past the blood-brain barrier. So it takes it everywhere that your body needs it. We're going to be doing also biocranial when Nathan comes in. Biocranial, adjusting his knee, and him taking this nutrition is going to make a huge impact on his repair and restorative process for his knee. We have taken people away from they were scheduled for knee surgery, didn't actually have to have knee surgery just because of what we're just showing you here. So again, my name is Dr. Augustine from Head to Wellness. I hope this information helps. If you have any questions, let me know. I'm on YouTube, I'm on Instagram, I'm on TikTok, and also Facebook. Have a great day.